Hello, everybody out there. You are tuned in to The Local Lens, the podcast from the Powell County Health Department and Kentucky Rio, where we go inside our community's experience with the drug epidemic. And we do that by having interviews. And we interview people that have some kind of real firsthand experience with substance abuse or addiction. Now, that firsthand experience could be somebody's own personal struggles with addiction. It might be somebody in their family or somebody else that's close to them. Or they could have this firsthand experience from their work, either as like a police officer in a place where a lot of the crime is driven by drugs, or somebody that might be a chemist at the forensic drug lab for the Kentucky State Police that is directly focused on drugs. So the goal of this show has always been to find people that have that firsthand experience and learn from them and get them to tell us what they see in their lives. Whatever their role or whatever their connection to addiction is, we want to find out about it. We want to learn about it so that we can see addiction better ourselves. What we like to say that we do on this show is we put addiction in the middle of a circle, and then we try to go around that circle finding as many different perspectives as we can. Because from each different angle that you look at it from, addiction looks different. An EMS director is going to see addiction differently than even a police officer or a nurse practitioner, and especially differently from somebody who has a history with addiction themselves. And then each person that has a history of substance abuse is going to see it differently than other people that also have similar histories. So probably our biggest goal with this show is to first recognize that addiction impacts all of us, and it affects us all differently too. So if we can learn to see addiction from more than just our own small singular perspective, we'll be able to see it more clearly. We'll be able to understand it a little better, hopefully. So we've done about 60 episodes of this show, trying to find as many different perspectives on addiction as we can. And now, 2 years later, I'm going to take a step back and try to look at addiction considering all of these perspectives at once. That is exactly what we want our listeners to do. We want to just be able to understand how massive and complicated addiction really is. Well, thanks for tuning in. This is The Local Lens. These are our people using our voices, telling our stories, because no one sees it like we do. So the task at hand for me today, as your host of The Local Lens, is to tell you all about the biggest lessons that I have learned. So really, I'm going to be trying to summarize over 60 conversations that I've had over the past 2 years and put it all into about 25 minutes of some kind of steady thought. That's going to be tough. But before we get going, I just want to really drive the point home that I personally do not have firsthand knowledge or experience about addiction. Before I started doing this show, I really knew nothing about it. I knew some of the basic things, but really, I had no depth of knowledge at all. And I'm hesitant to say that I have knowledge about it now, but the reality is I've learned so much from running this show and from having these talks with people. And the really fun thing about this show is that it has really been a recording of my learning experience with substance use. Theoretically, if you started with the first episode and listened to every single episode of The Local Lens, then by now, you and I would have pretty much the same base of knowledge about addiction. So we are going to start off with what I think is really the base of understanding addiction, and that is science. So the reason why I think science is the most important place to start is because once you know how addiction actually is affecting your physical brain, then it causes you to look at people that struggle with substance abuse in a complete different manner. Once you see it as the disease that it is and how people can come to develop that disease, then it makes having an addiction seem not like a character flaw, but like the outcome of all kinds of much bigger influences on somebody's life. So let's get a little bit into this science and neurology stuff. Now, we're not going to go very in depth on this because we have whole episodes about this topic. But what is basically happening is there's a chemical called dopamine that is floating around in your head and in your body. This is your feel-good hormone. This makes you feel good. When you do pleasant activities, your body releases some dopamine and your body feels good from it. Some things that release dopamine are exercise, kissing somebody, eating a delicious meal. Anything that people just find some pleasure from releases dopamine. Now, drugs were designed to release dopamine, and they're very good at doing that. They release an unnatural amount of dopamine, which ends up throwing off your brain's balance. So when you're using drugs, your body starts getting used to having more dopamine be released through it. Now, the only way you can consistently keep that amount of dopamine going through your system is continued drug use. And then you eventually want to push your ceiling of happiness even higher, so you start increasing the potency of your drugs and the frequency that you're taking the drugs. And you get to a point where normal things no longer give you any satisfaction because you're used to having this other unnatural amount of dopamine going through your body. Your brain gets so used to this, in fact, that if you deprive your brain of having the drugs, then you actually develop a physical sickness from not having those chemicals in your body. And it's excruciating. This withdrawal is very unpleasant, and the way to avoid withdrawal is to keep using drugs. Now, the chase to keep getting a higher high will lead you to using more and more drugs until you overdose. That is very basically a progression of somebody's drug use. Now, why would somebody ever develop this addiction? Well, we said that the dopamine is your feel-good hormone, so drugs will pretty reliably deliver on this high. That's what they're for. That's what people want them for. They want to feel good. And for a lot of people, happiness might be just very hard to come by. And that could be for a huge spread of reasons, and a lot of those reasons are completely outside of somebody's control. Let's say, for instance, that you might have been born into a family that has generations of drug abuse in their history. You would have been taught from a young age that the way that you enjoy life is by getting high. Now, if you're a kid and that is the model of what life looks like that you saw, then you can hardly blame that person if they grow up with some kind of addiction. A lot of people that I interviewed said they started their drug use at a pretty young age when emotions would have been very hard to keep corralled anyways. And you can see how somebody who is trying to find a way to calm their emotions and feel better would turn to something like drugs to help with that coping. And it doesn't work in the long run. Though it might deliver an incredible high initially, it will turn on you at some point and will start to poison your body and take all of your focus, all of your energy, and all of your money. Alex Ellswick called it the ultimate bait and switch in our conversation, where it starts by offering this insanely good feeling, but then quickly turns into some kind of monster that has such a grip on you. Now let's switch lanes a little bit and look at another way that people might have developed their addictions. And this goes back to painkillers and prescription opioids. Now, a couple decades ago, the medical world started really focusing on trying to eradicate the world of pain. And that sounds pretty good. They thought that we had some kind of solution so that people did not have to feel pain. So there's a whole generation of people that when they had some kind of injury and went to the doctor, they were handed a pocket full of opioids that we have since learned were very addictive. So people started developing that chemical dependency just by taking the medicine their doctor was giving them. Now, word spread pretty quickly, and people started realizing that you can feel pretty good from using these painkillers. So people started abusing the medical system that was giving out the painkillers. Now, at some point, the federal government started catching on, and they were shutting down this medical system that was allowing the painkillers to get into circulation. But when you press down on the top, it comes out the sides. People had already developed the addictions, and they were figuring out how to satisfy their cravings without the prescription medicines. And that gave rise to heroin, which has eventually led us now to fentanyl. So you've got this group of people that had developed serious addictions because of going to the doctor. So you've got people that have developed these addictions that you can hardly say they're at fault for. Now, yeah, there are definitely some people who chose to start trying drugs. But even then, and I've heard this told by so many different people that have lived this, even then, at some point, it is not a choice anymore, and it is really a survival method. The big thing that we need to remember about the science of addiction is that no matter how somebody developed their addiction, it really has this hard grip on people's actual brains. There is a physical change that happens in your body because of the drugs that cause you to be dependent on some kind of substance. Now, the good news is that you can fix this. You can heal from this disease of addiction, but it takes a lot of time. Now, over that course of time, our biggest job as a community is to keep the people that are using drugs alive. Now, that is the basis of the next topic I want to talk with you all with today, and that is harm reduction. So, what is harm reduction? Harm reduction is when you reduce the harm of a certain activity. So, driving cars is dangerous. So, wearing a seatbelt is a form of harm reduction because when you get in an accident, the seatbelt will help save your life. It will help keep you alive. A helmet is harm reduction for motorcyclists where if they fall off the bike and hit their head, the helmet might save their life. A parachute is a form of harm reduction for skydivers. Whereas imagine going skydiving without a parachute. That is harm reduction. So when you apply this thought to drug use, harm reduction is anything that is helping people stay alive if they're using drugs. So if you're going to embrace harm reduction, and I'm saying that you should embrace harm reduction because it's great, if you're going to embrace harm reduction, then in the same way that you have to accept that people are driving cars, therefore we need seatbelts, and people are going to go skydiving, so we need parachutes, you have to accept that people are going to use drugs, so we need things like naloxone. And it can be a pretty big hurdle for a lot of people to accept that people are going to use drugs. So I would like to make a distinction that might help with that between society and the individual. To put it bluntly, you are not going to completely get rid of drugs for our entire society. People are always going to find ways to have drugs and always going to find ways to get high. They always have, and they always will. What we have to do is make sure that individual people can rid themselves of drug use. Regardless of what their past looks like, they can always choose a healthier path. The entire thought behind harm reduction is that we have to keep people alive long enough for them to decide on their own that they would like to recover from their drug abuse. One of the ways we do this is naloxone. Now, naloxone is a kind of medicine that will reverse an opioid overdose. Now, Narcan is probably the most popular kind of naloxone, and that is a nasal spray that if somebody is overdosed, you give them the Narcan, and you might have to give them several doses of the Narcan as well, but it will revive them and will keep them alive. It's basically a way to make sure that people have another chance, not just a second or third chance, maybe a fourth or fifth or 10th or 15th chance. Whatever it is, it stops people from dying, and that's great. Now, one place where you can get Narcan is at the health department for free during the syringe exchange program. And the syringe exchange is another big part of harm reduction. So what is a syringe exchange? That is a program where people can bring in their used syringes and exchange them for unused syringes. Now, it is, in the title, an exchange, which means that we're not just passing out needles to people. We're not just giving people as many needles as they want. We will only give them out if you bring us some that we can safely dispose of. Now, this program is great for several reasons. Now, first, it is helping to cut down on the spread of awful infectious diseases like HIV and hepatitis C. Now, these diseases will cause your body pretty much to just shut down over time if left untreated. And if you remember from earlier, when we were talking about the progression of an addiction, I said that you can keep using drugs until the drugs cause your body to shut down from an overdose. Another option, though, is you could keep injecting drugs long enough that you get one of these diseases, and your body would shut down from that disease instead. Both options are bad. So by limiting how much people are sharing their syringes or just reusing the same syringe over and over and over again, we are drastically cutting down on the spread of these diseases. Another big thing the syringe exchange is doing is reducing the amount of syringes that are just out in the community in places. We used to find loads of these syringes around public places like playgrounds especially. And that would be awful if your kid is just playing on a playground and accidentally gets stuck by one of these syringes and gets hepatitis C. That would be awful. So this program is to reduce the chance of that happening. There's even a big financial reason as a whole county that we should be embracing the syringe exchange. The cost of treating a disease like HIV or Hep C is much higher than the cost of running a syringe exchange program. And a lot of times it falls on the government to pay for the treatment for these because of Medicaid, and that's a good thing. We should be protecting people that have low incomes, so not arguing against that at all. But that does fall on taxpayers to pay for this treatment. And common sense anyways would tell you that it's better to try to not develop any of these diseases anyways. It'd be a lot easier to just not get the disease than it would be to rid our people of the disease after they've already had it. In an interview with Judge Executive James Anderson, he said that it is just better to be proactive and try to get ahead of it rather than to try to clean it up afterwards. So with that same spirit and on the topic of finances anyways, I'm going to take a little side note here to talk about EMS and ambulances and how that is connected with addiction. So the EMS will respond to overdose calls, and we have a lot of overdose calls. And it's expensive to make runs to go to all of these calls. Now, I'm not saying that we shouldn't respond to overdose calls with the EMS, because we should be valuing human life of all of our citizens. What I am saying, though, is that we should be proactive and work together to try to collectively relieve the strain of the EMS. We should be doing anything that we can do to lower the amount of overdoses, because that would lower the strain of the EMS. They have a very hard job with a limited amount of workers and a limited amount of energy. There's a limit on what the EMS can do in Powell County, especially without having a hospital. Anytime they have to take somebody to a hospital, that means an ambulance is being used for over an hour just to get them there and then to come back. So if your EMS is having to respond to all of these overdose calls, that means that they are more limited for calls like strokes or heart attacks. So if you need some kind of selfish incentive to start caring about recovery and getting people out of addictions, then let it be this. The less overdoses that we have in our county, the more likely it is that the EMS will be able to quickly respond to your future medical emergency. All right, so let's jump back really quickly to the syringe exchange program, and I'm going to wrap that up real quick. The biggest thing that the syringe exchange program offers for our people is it is bringing in people that normally avoid the government at all costs. It's inviting them into the health department, into a medical provider's facility, and telling them, we have options for you. We can help you. You can recover if you want to. And that really is the whole point of all of this. So let's talk about it. This is all about recovery. The first thing I have to say about recovery is that it is only going to work if the person wants it. And that takes so much patience. If you are somebody looking at somebody that has a substance use disorder, it takes so much patience to just wait around hoping that they stay safe enough to someday find recovery. Now, because of the disease of substance use disorder, it can take a really long time because your vision is cloudy, your head is cloudy, it's foggy, you're not thinking right, your brain is not operating in its normal state. Your brain is seeking out how to keep that dopamine up and how to stay high longer. They're looking for what the next fix is. That's how people have told me over and over again how this disease prolongs itself. And it takes something like getting arrested or getting held in some place where you sober up to start to see clearly again. And to me, that is the role of law enforcement when it comes to drugs. It's not incarceration. It's not holding people in jail for years and years and years because they had an addiction to meth. No, here is what I think the role of law enforcement is. And this is coming from having these conversations with people who have lived it, people who have been arrested, and people who do the arresting even. A lot of people do need to get arrested at some point because addictions will drive people to acting manically and being an actual public safety hazard, and they can hurt people. They can hurt people they love. They commit crimes to support the habit. That is common. So it may take somebody getting arrested to really protect the community. Here's where the change needs to happen, though. Once somebody has been arrested, they could be held there until they sober up a little bit. but they should not just be left in the jail alone with no resources to help them improve and eventually just tossed back out into the world just to do it all over again. That's what we've been doing for decades. Instead, we need to start looking at how to give people the tools to help their lives get better. Because jail is not a place that is going to teach somebody how to change their life. Now, jail probably is going to be a turning point for a lot of people, but there's a lot of work that has to be done after the turning point happens. Now, somebody doesn't have to get arrested to find that turning point. That's where something like Casey's Law is so incredible. Casey's Law, to put it very briefly, is a thing where a family member or a loved one could get you court-ordered to go to a rehab facility. And Spark Ministries is very, very capable of helping anybody figure out how to use Casey's Law. So let's move on and assume that somebody has reached their turning point and they have decided that they would like to seek out recovery. What is important there? Well, patience. First and foremost, patience. Addictions oftentimes span over years and years, and it takes a long time for people to change their behavior. You're not dealing with puppets. You're not just dealing with abstract ideas. You're dealing with human beings that are going to be filled with all these complicated emotions, and recovery is really to restore a brain back to full health. I was described to it like this from April Smith. Your brain is operating on this certain path, and when you introduce drugs, your brain starts to deviate from the path that it is supposed to be on. And the longer your drug use continues, the further away from that normal, steady place it's going to be. So it takes a very long time to get back on that path. And there are lots of ways you can do that. One of the ways is using medicine, and that's called medically assisted treatment. Like there's one that's called Suboxone, that what it does is it fills that craving hole left in your brain without delivering any kind of a high that the drugs would normally give. And what this does is it lets somebody get past the urge to do their drug and just start functioning normally and get used to their normal dopamine levels again. It helps somebody relearn what more normal behavior is. And I shouldn't say normal there. What I mean is healthy and sustainable behavior. Some kind of behavior that is not going to end up killing you. And there are a lot of options when considering medically assisted treatment. But really, the bigger thing to remember about recovery is this. There is no set blueprint for how recovery works. It's different for everyone. And really, what it comes down to is you are trying to help people find how to have a healthy and happy life free of any dependency on drugs. You have to give people the chances to stand up on their own 2 feet and then encourage them to run with it. You know, we're just trying to encourage people to live well, and that takes letting people have responsibilities. Richard Penick said that people have the right to make mistakes, and that can be tough to let people make mistakes on your watch, but we have to practice trusting each other. You know, we have to give people the chance to prove themselves, the chance to stand up on their own, and we have to support people. And more than anything, we have to be patient with people and forgiving of people, you know, because these are people. These are our neighbors. These are our family members. These are our friends. Life is hard on a lot of people. Do not let yourself be the reason why somebody's life is harder, because at the end of the day, you don't know what they've been through. This is the local lens. These are our people using our voices, telling our stories, because no one sees it like we do.